The COVID-19 crisis has exposed the structural inequalities that invariably and disproportionately affect women and girls. In times of crisis, when resources are strained and institutional capacity is limited, women and girls face disproportionate impacts with far-reaching consequences that are only further amplified in context of fragility, conflict, and emergencies. Women in Law in Southern Africa, with support from ActionAid, conducted a research on the situational analysis of gender-responsive public servicing in the COVID-19 pandemic, districts Harare, Mutare, Bulawayo, Masvingo, and Mutoko. The findings from the research study show that violence against women and girls has intensified during COVID-19. The exacerbating factors include women and girls being isolated or locked down with abusers during the lockdown period. Intimate partner violence increased due to household poverty and starvation, as most people could not go to work because of the restrictions. The pandemic's economic impacts are likely to increase sexual exploitation and child marriage, leaving women and girls particularly vulnerable. They're also more prone to child marriage and other forms of violence as families find ways to alleviate economic burdens. Before the pandemic, women did 3 times as much unpaid care work as did men. Since the COVID-19 pandemic, several factors have added on top of this. The socially prescribed and entrenched gender roles that denote women and girls as care providers can undermine their rights, limit their opportunities, capabilities, and choices, and so impede their empowerment. Social distancing measures, school closures, and overburdened health systems have put an increased demand on women and girls to cater to the basic survival needs of the family and care for the sick and elderly. Since the closure of schools due to the pandemic, existing gender norms have put the increased demand for unpaid childcare and domestic work on women. This constrains their ability to carry out income-generating work because they spend long hours performing unpaid care work. Women's unpaid care work has long been recognized as a driver of inequality, with direct links to wage inequality, lower income, and physical and mental health stresses. Women generally hold more informal jobs with less access to social protection. COVID-19 compounded the food crisis that was already prevailing. Before COVID-19, Zimbabwe was already in dire need of food aid. This was bound to escalate beyond peak hunger period, January to March, in both rural and urban areas as a result of drought and poor economic performance. The United Nations Office for the Coordination of Humanitarian Affairs 2020 Zimbabwe Situation Report, last updated on 21st of April 2020, cites that nearly 3.4 million people received food or cash assistance in March against an estimated 7 million people in urban and rural areas who were in urgent need of humanitarian assistance. Under the COVID-19 pandemic, frequent hand washing under running water in most local communities was not possible. Water shortages have gone beyond Harare and have escalated into a national crisis. Water remains a challenge in many areas across the country, with many failing to access water 24 hours, 7 days a week. The role of looking for water predominantly falls on women and girls, who bear the unpaid duty of looking for the water, and have to spend long, productive hours waiting in borehole queues and water points. The water crisis that persisted during the pandemic placed women and girls more at risk of being infected with COVID-19 because no social distancing was observed at most water points. The best treatment against the virus is the washing of hands, hand sanitizing, and social distancing, which most people could not afford to observe due to the pressing need to get water, which was in shortage during the pandemic. The transport situation in Zimbabwe worsened under the COVID-19 pandemic, with the closure of the private transport facilities. The government provided transport through state-funded Zupco buses, which were not adequate to meet the transport demands of the public. Zupco buses were availed by government to provide for transport, but are not able to meet the daily transport demands. This has resulted in severe shortage of transport services across the country to the detriment of commuters, mainly women and girls. The challenges in the transport system that were noted during the COVID-19 pandemic are increased time spent waiting in bus queues, failure to observe social distancing at bus queues, failure by Zupco to disinfect the interior of the buses according to the guidelines, failure to observe the social distancing rules within the Zupco buses. This exposes commuters to greater risk of contracting the COVID-19 virus and also infringes on the right to life and health of those commuters. The health crisis worsened under the COVID-19 pandemic with a nurses' strike, which forced major hospitals to turn away patients at a time when the country was fighting the coronavirus pandemic. The strike by nurses and senior doctors has crippled public hospitals. The availability of personal protective equipment in hospitals was reportedly insufficient. COVID-19 has worsened Zimbabwe's health crisis. The sad images of 7 stillborn infants wrapped separately in green sheets and laid out in a row on a hospital counter in Zimbabwe have drawn public outrage. The public healthcare system is on the brink of breakdown, with shortages of basic drugs and equipment and an overburdened and underpaid staff.